There are two nerves that are involved with chronic hiccups. One is the vagus nerve, because that has to do with swallowing and eating, and many people with chronic hiccups have a long history of gastroesophageal reflux and all kinds of stomach problems, which I believe is from vagus nerve degeneration. The other is the phrenic nerve. The phrenic nerve innervates the diaphragm, and hiccups are actually involuntary contraction of the diaphragm. The phrenic nerve is made up of the C3, C4, C5 nerve roots. So if the neural foramina are narrowed because of ligamentous cervical instability, that can be actually the cause of the phrenic nerve irritation causing chronic hiccups.